Hello everyone, welcome to the channel and welcome to this video on golfer's elbow, which is a painful condition if you've ever suffered from it. I thought I'd make this video at the moment because a lot of us are returning to golf or had a period away from golf with various lockdowns around the world, and we're straight back in if we're keen to practicing and playing, and often we can get a little bit of pain around the inside of the elbow here. The medical name for this condition is medial epicondylitis, but it's actually an issue with the flexor tendons of the wrist. And you might think, but the pain's actually at the elbow. This is where the tendon attaches. And how is it caused? It's really through. It's an overuse injury, but it's really through high friction. So things like, obviously, suddenly hitting a lot of golf balls when we haven't for a while. Maybe you've had too many golf shots at the range. Also, I think looking at the surfaces that you're playing off, if you're hitting a lot off a mat at the range, that's a really high friction surface. So maybe look, sometimes there's a little more of a grassy bit on the mat. That can help to reduce the friction, and obviously maybe reduce the number of balls you hit as well. Might help. There are other factors. Sometimes it can be a posture issue, long periods on the phone. It can irritate also the ulnar nerve which runs through here. Sometimes just like a high keyboard at a desk as well. If the elbows are too high, we sort of get into this position that might irritate the ulnar nerve. Usually it's a combination of all of these things. But really that's how it's caused. And the next thing is how we start to treat it, or how can we help ourselves? Self-care wise, one of the best ways to do is to stretch the tendon a little bit. And that's very easily done. All we would do is just put the hands kind of in that position, and then we just stretch the arm back. Now this can be a little bit sore initially, and you just go gently with it, maybe for sort of 10 seconds or so, 2 or 3 times. Try and maybe do that at least once a day. The other ways, you could just stretch the tennis elbow side of things, the extensor tendons as well, and that would be that you just push the hand in that position and just stretch back. Sometimes you can go against the surface as well, like the desk, or a low table. You might just want to use that to passively stretch for you. The other thing is that if this hangs around a little while, you might want to do some strength work on these tendons. Initially, just stretching, ice, rest, which we're going to get onto in a minute, will start to ease this. But sometimes it's good to get some strength into this. A good saying for this condition would be forearm gains for elbow pains. So the way you would do that, you do need some dumbbells. You can't really do it with cables. Some of us obviously can't get to the gym at the moment, but you'd need a reasonably heavy dumbbell. Actually, these extensors are quite strong. And we do want to stress the tendon a little bit in a good way to create some collagen turnover in that tendon and start some healing. And the way you would do that is get anything probably from a 5 to a 15 kilo dumbbell. Obviously, if you're a little bit more like me, it would be a 15 to 20 kilogram dumbbell. If you're more slightly built, something sort of 5 to 10 kilos. And the way you do that is it's eccentric strength work. So we would flex the wrist like so with the dumbbell, and then it's slowly lower. So you just come up and slowly lower, and it's that slow sort of way down there is the eccentric strength, and it's just strengthening that tendon as you go down, and that really does help the collagen turnover. So think about initially doing some stretching, changing maybe the surfaces that you're playing on if you're hitting a lot of balls on the range, off a high friction surface. and also start the stretching, you know, and that should be enough to get it. If it does become a bit more chronic, you will have to do some strength work as well. And with that, I do sort of 12 repetitions, maybe twice most days with the strength work, and stretching it at least once a day. So that's really the kind of rehab side of things. And treatment wise, obviously you could come and see somebody such as myself. I'm sports therapist, degree in sports medicine, here in my practice in Selsey Sports Therapy in West Sussex in England. Or, you know, follow some of the advice in here. And one of the best ways to treat it is with some cryotherapy. So with some ice, you can literally get anything in the freezer. Often freezers just come with these little cooling things in them. This isn't actually too cold. It's been out for a while, so I can put it directly on the skin, but be careful because you can get an ice burn if these things are really cold. So you might want to wrap it in a damp tea towel, which will conduct the cold but won't give you that ice burn. So you literally, you know, obviously just place this on the skin. 5 minutes is probably enough, just on the painful area. Mine is a little bit sore at the moment, just above the tendon here. So I've been doing a little bit of this, but I'm going back into golf again after the break. We've just come out of lockdown here in England last week, and I've played every day and been hitting balls every day. So it's a little bit sore, but it's not too bad at the moment. So icing this will help. That's one way of icing. Do that, yeah, sort of at least 5 minutes if you can, just a little bit of compression on there. Another really nice way is if you can get one of these ice up massages. If you, you know, do a little search for these, I think they're called ice up massages, but there's probably lots of different things. You just pop some water in that, pop it in the freezer, and then you can push the bottom through and get this nice little sort of lollipop, which it's a little bit drippy, obviously, so you might want to use the towel, but really nice way just to get some nice cold on there, a little bit of ice massage. If you are going to do this, keep it moving again, because we can get an ice burn if you just hold it on. And there's where mine is a little bit sore. And yeah, I don't know, do this for a minute or two, really cool the area. It feels quite nice actually. It's not painful to massage it like that. So that's sort of self ice massage. Obviously, if you come to see somebody like me, somebody might have an ultrasound machine, which would do a very similar thing to that actually. May just reduce the inflammation a little bit more and promote more healing with ultrasound. Or another very effective way actually is to use acupuncture. I've just got some acupuncture needles here. Obviously I can do these to myself because I'm a licensed acupuncturist, but please don't do them to yourself. Do go and see you know, an acupuncturist, or your physio may also do acupuncture, such as myself. Yeah, and what they will do is they just tap a needle. They're very fine. It's not like having an injection. They just tap a needle. There's some nice acupuncture or trigger points around the elbow here and around the ulnar nerve, and we would just tap them in, and it creates a little bit of local circulation, which again can reduce the inflammation. Often acupuncture has a nice effect on the central nervous system as well, quite a calming effect, and can help a little bit with the pain. So golfer's elbow. I hope those ideas helped, and do subscribe to the channel if you want to see some more content on various golf videos and therapy videos. Okay, best wishes. Take care.